Well, we promised to start on time and end on time, and my little clock says 4:00, so we're going to go ahead and get started. Thank you so much for being a part of our LifePath Hospice, our first ever front porch chat. I love the idea of getting together on the front porch and visiting. You know, homes used to be built around a porch because it was such an important part of daily life. Neighbors would stop by unannounced. Knees would be kissed when toddlers fell down. First kisses would be shared on a porch swing, and tears would be shed as children went off to college, and hands would be held as couples settled into being empty nesters. And you know, the porch is really a place of community, and you are our community. You invest in those who need hospice but don't have funding. You bring healing to grieving hearts. You hold the hands of our children who've lost someone they love. We are so grateful for each and every one of you. It's really, these last few months, it's really proven your friendship to our mission, and we even need you more than ever. And we're really thankful you joined us here this afternoon, choosing to spend your time with us. So we're gonna have a great little 45 minutes. We're gonna start with Melody Stried, the Executive Director of LifePath Hospice, and she's gonna share some updates, as well as Sarah King, who's our Manager of Social and Volunteer Services. She'll share some updates on our grief support. And then we have a really special video to share with you all about a journey of one of our campers. If you have any specific questions, we encourage you to use the chat box, and we'll save some time at the very end to answer those for you. So we will go ahead and get started. So Melody, are you ready?
I am.
Hey, you can see Melody's on her front porch via Zoom call, but she looks good and she's rocking, so we're feeling peaceful. So Melody, can you tell us a little about who you are and how long you have been with us at LifePath Hospice?
Sure, I'm Melody Stried. I am coming up on my second year anniversary. So I always say that's like 14 years because I consider every year here sort of like dog years. But yeah, it's been a fun ride.
Great. Can you give us some facts about what's happened in, let's say, like the last 100 days at LifePath Hospice?
Oh, a lot has happened. A lot happens every day. So last 3 months or so, really COVID took all of our energy beginning middle of March. You know, just like all of you, we were kind of blindsided by it. We think we're pretty prepared in emergency preparedness, but not exactly had we expected the pandemic to swipe at us. But I have been blessed with an amazing leadership team, and a team that's been dedicated to LifePath for a really long time. Brenda is my clinical administrator, and she's been here for over 20 years. So they all jumped right in. Our first and foremost was making sure our staff were safe, and that included a mad dash, frantic, across the country, across the universe, look for PPE. So folks from the home office were working on that literally from wee hours of the morning throughout the middle of the night because of time changes. And I can say today we're in really, really good shape with PPE. And a lot of that is thanks to our donors who stepped up and made sure that our staff could stay safe. We also made an early commitment had a conversation with Andrew, Dean, the whole ET team to decide that we're not going to run away from this. Liz knows that I often respond to hospice as the silent first responders because we run into situations all the time, just like you would as if you're a first responder. We do not shy away, and we were not going to shy away during COVID. So we made a quick decision to turn the Malesh house into a COVID house. We started with a wing, and then we went to a wing of anybody that was suspicious, so they couldn't go back to their nursing home or the family couldn't take them at home, but they weren't COVID positive. And then we flipped that as we heightened come June to a 2-wing COVID positive. And then it didn't take long that you all know we were really hit hard here in Florida, and it's been a full COVID hospice house for the last few months. I will say this evening will be the first time that we have gone back down to 2 wings, and we will be taking regular GIP level care patients starting tomorrow in 1 wing. So that feels a little bit normal, and that's a nice feeling because our numbers are trending downward.
That's great, Melody. And I get so many questions about the Malesh Hospice House, and so why don't and COVID. So why don't we kind of jump to that? So when I talk to our donors, a lot of you, they ask very specific questions. So I'm going to ask you what I'm asked, and you don't feel like you have to answer all of them. You can keep them kind of brief. But these are the things that people ask me when I say we have an entire hospice house dedicated to COVID patients. One of the questions you ask me is, where do these patients come from? So where do they come from?
I would say 95% of them come directly from hospitals that have been overcrowded. And when they get to the point to know that they're not going to most likely survive this, or now they're hospice end of life appropriate, the big push to move them to us at Malesh is because they haven't seen family. And at Malesh, we allow 2 family members in a 24-hour period to be at the bedside of those patients, which has been a gift for so many people.
Yeah, that's great. Well, tell us a little bit about the visitor policy, because I know, just like you mentioned, so many are seeing their family for the first time. What does that look like on any given day?
So it's 2 visitors in a 24-hour period. So we don't have family members cycling in, because we want to keep them safe as well. Anybody that is COVID positive or suspicious for COVID that's a family member, we've unfortunately not been able to allow them in. And then we have been able to provide PPE for any family member, full PPE, coming into the Malesh Hospice House.
That's great. And so you talked a little bit about if you maybe are COVID positive. I know I've talked to some people who had other children at home and they didn't feel comfortable coming into the house to say goodbye to their loved one. What happens when a patient doesn't have family with them?
Well, we've gotten creative, which is one of the things I love about hospice, is to think outside the box, and I push staff all the time to do that every day. Early on, in one of the first wings that we did, we put up a tent outside the window because we had a COVID positive husband, and his wife was inside, very imminent. So we put up a canopy for him to sit under, and we rolled her bed right up directly to the window, and they held hands up against the window plate. So that was tough to watch, I'll be honest with you. And if somebody absolutely has no family present, of course, as in many situations, COVID or not, we become their family. We are the hand that they hold. We give them those last hugs and snuggles, and we're at their bedside until they pass peacefully.
Wonderful. Thank you. I know that to all of you, I know it brings comfort to me, because that's the core of one of our values at LifePath Hospice, and hospice actually around the world, is that no one ever dies alone. So that brings a lot of comfort. So another question I often get asked when we talk about COVID in the hospice house is, how are our staff doing? Do they, what are we doing to protect them? And tell us how the staff is doing specifically at the Malesh Hospice House. And we'll talk about home patient staffing in a minute, but just specifically at that COVID positive hospice house.
Sure. I never lie, and I'm always pretty transparent. It's been really, really hard, and it gets harder every day, every week, every month that they have to keep doing this. I have so much respect for them, because I'm the first to say I'm not the best mask wearer, especially wearing glasses, and they all have to wear goggles as part of PPE. It's mandatory. I see many people with glasses on. There's nothing more frustrating when you can't breathe from a mask and then you cannot see because it's fogged up. So they, every single time they go in a COVID positive room, they have to do a complete donning, we call it, of PPE. So they're putting on a gown, booties, headwear, a mask, goggles, gloves, taking care of the patient, whatever the need is, donning it all off and leaving it in there dirty, and then coming back out. Every time they go back in, they have to repeat that. It's hot and it's long days. They do 12-hour shifts at Malesh. So that's what they wanted to keep, and we respected that because that's their schedule. The other thing we did immediately is we put iPhones that are attached up on the corner of the bed console. So if they don't have to go in and the patient just needs to talk to them, they can do it from the desk. So that proved to be helpful as well. And then we can help family members that can't come in, connect to that iPhone and see their loved one. But it's been hard. Yeah.
Yeah. Well, thanks for being honest. It's the one thing we love about you is you don't sugarcoat things. And that's what our donors want to know. All of you want to know is really what is it like? And I want to also say thank you. I won't call out all of you because there's too many, but all the work you've done to help we call it refueling the front line, by donating lunches and gift cards and really supporting our staff. Every time we ask, what can we do to help you? The answer is always the same, is food. And it's simple. So we don't have to do a lot of crazy things. They just want something that comforts them and something that's easy for them, run through a drive-through, have lunch delivered to them. So thank you all of you for, some of you have provided it, some of you have actually driven for us. So we're really, really grateful for that. So Melody, we're gonna turn a corner from the COVID Malesh Hospice House and talk just about home patients. And so I guess my question is for our staff, which is a majority of our staff who are caring for home patients, which is a majority of our patients. Just as a reminder, we care for over 1,200 patients every day in Hillsborough County, and very, very, very small. We only have 48 hospice house beds. So majority of our patients are cared for either wherever they call home. Sometimes that's their physical home. Sometimes it's a nursing home. Sometimes it's under the bridge. I just was talking to someone about one of our patients, and his home is his car, and that's where he's happy and that's where he wants to be. So with that in mind, tell us what a day is like for one of our hospice house staff. Maybe remind us of what makes up a team, all the disciplines, and then what is it like for our staff who are caring for home patients?
So it's the same team no matter where you're at. So you have a primary nurse who's your case manager. You have a consulting physician and a nurse practitioner as part of that team. They're led by their clinical manager, and then the partners to the nurses are the social worker, the chaplain, the aides, the volunteers. And then after they pass, of course, we hand them off to Sarah's amazing bereavement staff. Home has been at times even more scary than in the hospice house because you don't know what you're walking into. We try really, really hard with every referral to screen. We ask the staff before they go back in to screen again, because we'll be in the house and we'll say, oh, well, Johnny in the bedroom tested positive for COVID, but grandma out here is fine. And the staff panic, even though now they're in full PPE. We've had some scares. I mean, and that's been my biggest thing. And I've kept my fingers crossed since March, is to not lose a staff member. And we've had quite a few scares. At one point, at our most heightened point, we had 70 staff out, COVID positive or symptomatic. But I think the hardest thing for our home staff teams really hit us this week. And as much as you think you're kind of over it or we're, numb to it, we had a hospice aide who back in July, probably providing care. She's part of kind of our primary Spanish speaking team. We never know where you contract COVID from, but you can assume when you're in healthcare, you have a much higher chance. So she became ill and she went on quarantine. She became iller and ended up for 10 days in the hospital, very ill. She came out to come back home and take care of her parents. Her father went in to the hospital a couple weeks ago. Within 3 days, her mother went in, and unfortunately, both of her parents have passed in the last 72 hours. Oh, so you want to talk about hitting home? Everybody here on the field teams, we're just riveted by that. I mean, I get choked up talking about it because I've lost both my parents, but I had 20 years in between. I can't imagine 72 hours from an illness that you yourself probably feel you were responsible for. So it's not slowing down. It is on some level, but on other levels, it hits us really hard still every day. So the home is an unknown environment, but we go in ready to serve.
Yeah. Well, I love that we're courageous and strong. And, at the beginning of 2020, Kathy Smith and a couple of us on this call were in some meetings, and we talked about a theme for 2020 for our Home Runs for Hospice event, which we're going to actually invite you to. But we talked about what do we want our theme to be this year. And Melody, you're the one that talked about having hope as a theme, because when you see hospice, you see hope. And that's almost a paradigm shift, because a lot of people see hospice and they see sadness. You see hospice, you see hope. So can you kind of share your philosophy around hospice and the word hope and what that means to you inside our mission?
Sure. So if you take, the S and the C out of hospice, you have the letters of hope. So hope is embedded in hospice, not only the word, but in the care that we do every day. And when I talk to patients, and I still love to go out, in fact, I'm going to go see a patient tomorrow to do the sign up. a young pancreatic cancer patient that I got involved with, and I'm going to go meet him. And I tell them it's a paradigm shift. We often, when we come up, to terminal illnesses, we think about hope for a cure. When you come onto hospice, it's not giving up hope. It's just a shift in hope. So it's hope to be comfortable, to be pain and symptom free, hope to die with dignity. It's maybe hope to be home, where if you're not going to make Christmas or graduation, we're very creative at moving those events up. So it's hope in every single day. And yeah, when you're on hospice, you don't look long-term, you look short-term. And sometimes it's, a week, sometimes it's a month, sometimes it's the next few hours of hoping for what you want to accomplish.
Great, thank you so much. So we're going to kind of turn the corner again and shift to TID and talk about this amazing new program, or not even a program, but this amazing new service called Care Connect. So inside, we know what Care Connect is. I don't think anyone on this call has even heard the two words put together because it's so new for us as an organization. So will you share a little bit about what is Care Connect, why is it important, and what does this mean for our community?
Sure, it's new, it's very innovative and unique, and I'm excited about it. It's got some different components. How it will affect us directly in the hospice world is eventually we will go to one call. So that's going to be a little bit of a shift for everybody at LifePath who knows that main number and loves it, and has had that same number for 30 years. The number is going to change, but that number will still be answered. So our patients will still be able to get through. But the goal is to have your call answered by a nurse versus a receptionist. We're working out some of the kinks on the answering service. It went fine when HPH Hospice went live, but when I call the ship of LifePath moves in, it's a whole new world when we unload our calls and our numbers onto a system. So like any system, we're working through the kinks of the phone piece of it. But everything will kind of be centralized for our intake and our admissions. So quicker to the phone, quicker to the bedside, quicker to the patient. That's always our goal. When they need us, we can get there. The other two components of it that are really neat is we'll have a resource team. So not only right now we have HH24, our after hours care, we'll have that same resource available from 8 a.m. morning, 24 hours a day, and they'll just transition. Nobody will even know on the back end when it goes to the night team. And then the final leg of it, which is the newest piece of it for us, is called Care Navigation. And so anyone that, like I referred to Care Navigation today, I've been working over in Care Connect and helping them upload all of our LifePath services and all of our folks there for the last few weeks. So it's been exciting and fun for me. But Care Navigation will allow someone who doesn't fit into the whole of hospice or home care or palliative to still stay within our family, as I like to think of it. So we had a patient who wasn't ready for hospice, didn't really need palliative care, and didn't qualify for home care. So we put them in the Care Nav, and the Care Navigators were able to help them get a caregiver and sign them up for Meals on Wheels. So that's a perfect example of someone staying attached to us that isn't needing our exact service today.
That's great. Thank you, Melody. We're actually going to shift over to talk to Sarah King about grief and services. I did want to just kind of give a few stats, just for anyone who likes numbers. Over the last 100 days, we've cared for over 2,800 patients. So that's a good number of patients. We've had 191 patients in our Sun City Hospice House and almost 249 in our Malesh Hospice House. So that's a lot of patient care that we're giving at the bedside. And sometimes, as Melody said, we're the ones holding their hands as they pass from this earth. As far as maybe just doing a quick introduction to Sarah, her team of 7 grief counselors, they've done over 1,000 one-on-one grief counseling sessions. And we're going to talk about how do you do that in COVID world, but we've had over 1,000. And then we've either answered the phone or talked to over 2,700 people who are either calling in to ask about our services or we're calling out to see if they need our services. So over the last 100 days, if Melody and Sarah look tired, this is why. They're doing amazing work. So Sarah, let's shift to you. And so we talk about grief and love and loss and heartache and hope sometimes in the same breath. So what I want to ask you is tell us what has been going on in the grief journey during the COVID time and what that has looked like for our community.
So the thing, like Melody, we realized pretty quickly that we have to come up with a different way to support our survivors. our survivors aren't just our LifePath family, they're the community. So one of the things we wanted to do is make sure that we did this in a safe way. So we went to tele-therapy, and tele-therapy provides individual counseling either on a Zoom format like we're using today, or we use FaceTime, or we use just a plain old phone. This is proven to be really effective. We weren't sure, this was really uncharted for us. We've always done the traditional route of seeing people face to face, but this has actually worked out beautifully, and I can see where there would definitely be a need to continue to provide this even post-COVID. We're also so grateful to LifePath Management and to Chapters, to Melody, for supporting this vision, for allowing us to say, our survivors are grieving even more intensely at this point. How do we take care of them? I mean, people are still dying. And so how do we take care of those that are left behind?
Well, that kind of goes to my next question, and I've heard this a lot from people, and I'm sure everyone on this Zoom call too, is that COVID has kind of exasperated, maybe is a good word, the grief experience. So tell us a little about how you see that happening and what you see the hope is in really this whole, women who are alone for the first time without their spouse facing something this serious. How has that journey gone for the ones we are caring for?
So it's a great question. The reality is we're all impacted, as Melody mentioned in the beginning, by COVID. And what we're seeing, and really it's amplified for our grieving family members, is they're very isolated. Their sense of connection for our families right now is so different. I went to a funeral recently for actually a staff member, and his whole family from Delaware and New Jersey did not travel down for the funeral. Now they're going to have another funeral at a later date, but it just really hit home what that looks like for all of our families that are trying to embrace the mourning and their grief. So that's really, I think that's a big important factor. People are dying alone. You heard Melody. I know exactly who she's talking about because I saw the tent where the gentleman was outside the window. So, a year ago, we wouldn't even be thinking about this. But we do realize people are more isolated, and it's more critical that we find ways to bring people together.
Well, and I think you have found what other people have found is actually when you're making those outbound phone calls, people are actually answering the phone, right? So
Right.
People are home and they're looking for connection, and I think it's great that we're there to help solve that. So we're going to talk for a minute. I know a lot of our friends on the Zoom today are big fans of our Circle of Love, and they've touched and been a part of our grief center and our camp. So tell us a little bit about what is happening with our Circle of Love grieving children, with not only the ones who come, every other week during the regular school year, but also camp. So share a little bit about the services that you've been providing to the children.
So I recognize so many faces on the call right now, and so many of you, you just have supported us in so many ways, and especially with our grieving children. And it was really difficult this year, right? I don't think I've recalled a more organized camp that we had prepared for 2020. And sadly, we had to postpone our camp. In talking with Liz, we came up with an idea of having a camp at home. So starting in May through July, we actually did a camp at home program for our camper families. And that included about 100 different families. We sent them all the materials to do an activity. We included a gift card or something special just to really let them know we're thinking about them. And then we did a videotape of what that activity could look like and how to do it. And I think someone, maybe Stevie, has some of the pictures that we got back from some of our campers. This was really, this again was just a new idea because we were just wanting, the kids are still grieving. They still lost someone they loved. So what can we do to help support them? And this was something we tried. Now we're continuing with our Circle of Love program, and several of you are actually volunteers with Circle of Love. What we found, however, is the attendance has really kind of waned on that program. But what we did find is something we did last year and the year before was called Summer Saturdays. And I think some of you have been involved with that. And we're going to try that again for September, October, November, and December, where we actually are going to give the families all the materials to do an activity at home, but it's going to be done by Zoom. And I think that's the important piece that we're really recognizing. It's better if we're connected when they do the activities. And this will be a tremendous amount of fun, but also some specific activities to help the children and the whole family work through their grief. We're still doing our Tuesday and Thursday nights. Mindy and Betty and Kathy's on the phone, on the call right now. The littles and the teens we meet with on Tuesday nights, and the middles and the adults we meet on Thursday night. But again, based on the attendance, we're going to reevaluate things and figure out, what's the best way to support our families right now.
That's great, Sarah. I love how innovative you are, and you're changing with the times where schools, at weeknights might be hard for the kids to get on Zoom again. So moving that to Saturday is great. So my last question for you, Melody talked a little bit about hope and where she finds hope in the world of hospice. Will you share a little bit about where you find hope?
Sure. I think just, looking at everybody on this call right now, seeing the support of all of you in the hospice mission, hearing what Melody shared about what the teams are doing, and Malesh taking care of our COVID positive patients. Every day I'm honored to work with an amazing bereavement department that really just, despite their own fear and their own worry and their own adjustment to living in this world right now with COVID, they're doing an amazing job to take care of our grieving families. And that's what really gives me hope, and that no matter what is being thrown at us right now, that we are able to respond and find a different way to take care of our families.
That's wonderful. Thank you so much, Sarah, for joining us on your front porch. We are now, speaking of hope, we're actually going to transition into a video of a young girl who was a camper at Camp Circle of Love in 2019, and she's going to share her current journey with you. And if you can, go to full screen so you can see the whole video on your Zoom call.
Dear Mom, I have big news. You're not going to believe it. But before I tell you, I have so much to share. First, I miss you. I miss your laugh. I miss our missionary work in Honduras. I miss the way you looked at me with a heart full of love. The day I said a forever goodbye to you, I thought my tears would never end. But as you taught me, I picked myself up and set about the tasks ahead. I did my schoolwork and took on a part-time job. The days were hard, the nights were lonely, and when I didn't think I could miss our life together anymore, Dad kicked me out of the house. In just a few years, I went from a hope-filled young girl to a homeless orphan teen. I slept in my car at night and showered at a friend's house in the morning, somehow kept up with my schoolwork. Even though you were gone from this earth, your love never left. You gave me your best friend Cindy as a second mom. The promises she made to you convinced me to spend my last 2 years of high school with her and her husband Mac. They not only give me a place to call home and love me as their own, they introduced me to Camp Circle of Love, a place for grieving kids like me. At camp, I learned I was not the only one who felt fearful, sad, lonely, and guilty. Meeting other teens who have also said a heart-wrenching goodbye to the one they love the most helped me heal. The grief exercises gave me tools in my toolset to deal with losing you. I realized that I had not laughed since you died. A piece of me went with you, and at camp I found a way to get it back. I returned from camp different, lighter. My godparents noticed it immediately, and so did my friends. I continue to put one foot in front of the other, and thanks to Camp Circle of Love, with a smile on my face. I think you would be proud of me, because I've turned ashes into beauty. As I began to apply for colleges, I had to write essays on who I was, what I want to do, and who I want to be. Many of my friends struggle with these questions, but not me. I want to be just like you, dedicating my life to something bigger than myself. I want to return to Honduras and do the work that cancer robbed you of finishing. And since you're not here to mold me, to shape my character, I found the next best thing. I was accepted to West Point. Yes, Mom, West Point. Can you believe it? I know you had a hand in this because the day I arrived on campus, the day I will meet my forever friends, the day I will start my journey of duty on our country, is the anniversary eve of your passing from this earth. I will be thinking of you, holding you close in my heart, each fabulous and difficult step of the way, Mom. You'll always be my confidant, my best friend, my Mama Miriki. I love you. I will write again soon. Love, your daughter, Victoria.
So Victoria is our hope, and she's our hope in motion. We had the honor of spending some time with Victoria over the last year, and the one thing I love that she said is, she said, you know, everything that happened to me just happened. I had no control, I had no choice, and I got to choose West Point. It didn't choose me, I chose West Point. And we've been in touch with her. She made it through her beast, that first, you know, really hard 4 to 6 weeks, and she's doing great. She's doing really well. So we are excited to share her story with you, and you are a part of her story. You are the ones that help support all of our hospice programs, including our grief center. And it is your gift that helps support the lives like Victoria and the lives that are actually changing. So we say thank you very much. We have a few minutes. I don't see a lot of questions in the chat box, but you might have questions listening to Melody and Sarah share a little bit. Does anyone have a question they'd like to ask either Melody or Sarah? And Adam Stanfield is here, our VP of the foundation and our development office, if you have a question for the funding part of what we do. Any thoughts, questions, ideas? Renee?
Yes, I was taking some notes, and you said you had 1,200 patients, over 1,200, and how many hospice beds?
We have, well, Melody, you answer. There she is. Well, we have 48 hospice house beds.
So the 100 and some in Sun City are not in a home.
Those are people who cycled through in the last 100 days. So
Okay.
they may have been there for 2 days. We just had a man that was with us for 44 days, but most of the stay is 3 to 7 days of the time in the house. Great question. Anyone else? I'm looking around the squares. Don't be shy. Is everyone good? All right. Well, we are so grateful that you spent time with us today. Thank you, Melody and Sarah, for sharing your time and all the information. I would really love to invite you all to our home runs for hospice. Some of you know about it. It's going to be the morning of October 7th. It is going to be virtual on a Zoom platform, but it is a different platform. You will see us, but we will not see you. So you can come in your pajamas. You don't even have to get out of bed. Or if you're in your office, your home office, wherever you are, it's a different platform where you'll see our 1 hour event, but we won't be seeing you. So we hope you'll consider joining us for that and being a part of it, because you're so important to us.
What time is it?
It's at 8 a.m., 8 to 9 a.m., and I'll follow up with an invitation to all of you so you know exactly what it is, and we'll send you a little Zoom link, and then you can pop right in.
Thank you.
Yes, yes. Well, I just want y'all to know as you close your eyes tonight that you are helping hospice patients, their families, as well as our grieving hearts. And I did a little homework experience this week, and I wanted to share it with you all as something fun to do. Our kids are now doing homework if you have any family in school, and so we can all do a little bit of homework too. But it was an exercise that instead of thinking about what I can't do in these days of COVID and staying home and staying safe, was to write a list of what I can do and to find hope in that. So some ideas of things that we can do and be grateful for is like walking in the evenings with your family, or making a special dinner with your daughter, writing an encouraging note to a friend, or even planting a new garden, taking a Sunday drive. I know that used to be a big part of my childhood, was going to the car on Sunday and taking a drive, the big outing for the day. So the list can be pretty long. So I just encourage you to kind of shift that from all the things we can't do to things that we can do, because they do bring us joy and hope, and looking through the lens of gratitude makes a really big difference. So thank you for being with us. Stevie and I would love to visit with you anytime on Zoom or the phone. We are here, would love to be with you. But you are our family, and we appreciate you very much. Thank you for your time today.
Thank you.
Thank you, everybody.
Thank you.
Thank you very much.
Have a great evening.
Thank you.
Thanks, you too.
Bye-bye, everyone.